Welcome back to Living Healthy. It's time for Knowledge is Power. And with me today is my esteemed guest, Dr. Lucia Ambrochi.
Hello, Phil. Nice to see you
Great
again.
to have you.
Yes.
And my dental specialist here from West Hills Dentistry, and I appreciate being on the show today.
It's always my pleasure. It's amazing to be part of your show.
Thank you. And one of the key things we want to hit on today is something that a lot of people may not realize, obstructive
Sleep apnea. A lot of people really don't know what that's all about, and we're still learning as a dentist and doctors what's that condition and what it can do for us. It's amazing.
Because a lot of times children and adults think, well, snoring is just snoring, but snoring is more than just snoring, right?
That's correct. 60% to 80% of population who snore, and that will be the adults or children, they may be having what is called obstructive sleep apnea. When during the night time, when the people relax and go to sleep, the back of their throat gets collapsed and they maybe stop breathing at night, or they may have problems sleeping through the whole night, and that will affect their overall health as well.
Really? And for adults with the snoring, is this something different compared to children with the obstructive?
Not necessarily, no. The condition can be the same for adults as for children, except that we show ourselves a little bit differently. Adult will wake up in the morning and will still be tired during the day.
Right.
They may be falling asleep while they talk to each other while driving. A child otherwise will go to school and be overactive and will have problems concentrating. They may come back with a report card and the marks are actually much lower because their IQ can drop quite a bit. The reasons for that is that during the sleep, if we don't get enough proper sleep, the oxygen levels is low, and it affects our overall health and affects our stamina as well.
Totally. Yeah, it's a matter of getting to that deep REM sleep,
That's correct.
Sleep
when
that we need.
We're like computers. When we're in the REM sleep, we usually back up all the information and truly rest. The body relaxes it all, and all the organs receive their oxygen consumption.
That's a
and
good
if that
way to
doesn't
put it.
happen, then the heart and all other organs are kind of tired all the time. They feel overwhelmed, and they don't function the same way.
And you're hitting on something that can really be quite a serious condition, isn't it?
It is a very serious condition because it can decrease somebody's life expectancy up to 20% due to increase of chances of the heart attacks, strokes, hormonal changes, accidents on the roads. A lot of people would fall asleep because they're so tired and they'll get themselves in trouble. For children, it's even worse because they don't develop the same way. They don't have the growth spur many times, and they become very agitated as well, and they don't rest properly.
That's a lot of repercussions, especially in childhood.
That's true. And many times we don't realize that when we see a child who is overreactive, we probably put them on mood alteration medications, trying to calm them down when they actually truly need a good night's sleep without any obstructions.
Gotcha. Wow, that's something. So if we look at children and adults, obviously from your perspective as a dental specialist, which oftentimes people aren't thinking about, the dentist and
to looking at those
obstructive sleep apnea. Now, what do we look for as far as families out there with kids? Is there certain things that you would suggest to be a solution to that problem when people see it?
Definitely. If you think about it, you probably would see a dentist more often than you would see your medical doctor for regular checkups. We check and screen for sleep apneas. We'll look for any obstructions. Many times the receding jaws or small jaws or missing teeth in an adult will make the tongue fall back and block the airway at night. For children, the same. When they develop, we're looking for any signs of developmental problems with the jaws, and those children may have large adenoids. We may talk to the parents, and the parents will say that the child is grinding at night. The child is snoring at night. The child may have to wake up a couple of times a night to go to the washroom because they can hold it in, and they don't grow as well. So they look a little smaller and they feel not as well. And we as a dentist can truly screen for it. We have somebody for the checkup and refer to medical specialists for assessments, for sleep studies, and that's very important for us to do that.
That's amazing.
Yeah,
because oftentimes you're going to be that first point of contact.
That's correct. That's correct. And again, many
problem,
times the reason for it is the collapse of the backside of the throat and the tongue as well. So we can spot some things that are important to us. Anybody who is a mouth breather, anybody who is a gagger may have issues like sleep apnea as a result as well. So
that's really amazing. Yeah, it's one of those things that often people don't think
realize,
about.
and that's truly correct. If somebody is diagnosed with sleep apnea, we actually can help them out as a dentist by fabricating a special snoring or jaw repositioning appliances.
That's wonderful.
And the most important part that I can't emphasize enough is that we can take a child who has problems already as a child and help them develop properly. So when they grow as an adult, they don't go into severe obstructive sleep apneas as well. That's just catching it early and treating it early if they have any problems with the jaw development, any problems with the airway.
Right.
And we are the first ones to kind of know, because
that's amazing.
They sit in our chair and breathe with us when we work on them.
And that's good to know, because you hit a very key important point here, is the fact that you're getting to the root of the problem. You're not just providing symptom relief on something. This is all about getting to the root.
It's getting to the root of the problem, figure it out, what's causing the obstructive sleep apnea, and taking it from there.
That's perfect. Thank you very much, Dr.
You're welcome.
Lucia.
Thank you.
Always a pleasure.
Yeah.
We'll be right back with Living Healthy after the break.